Dr. Hawkinson, first, the most odd-seeming symptoms seem to be losing taste or smell. What's going on with this toe as a possible symptom here?
Yeah, the COVID toes? I don't know. You know, we do understand, just like you were saying, this causes a myriad of symptoms. We know that the main receptor for the virus is on many different tissues. We know it's in the lungs, in the heart, in the kidneys. It could be in the skin. We know that the viral effects, even if it's not direct viral infection of the areas, we know that it can have a lot of effects in the body, just the inflammatory process and the negative effects of having the infection in general. So, you know, we are going to have a dermatologist on at one point, but we understand also that you can have other just simple rashes as well. And so, again, I think as we get more and more information from our experience here in America and other places are starting to report, we'll kind of understand these things a little bit more.
Yeah, hope
Doctor,
so.
is this something where if you start to notice something odd with your toes and you've had maybe some of those other symptoms, you should try to look into possibly getting tested? Or what's the point you look at your toes and go, wow, this could be something?
Yeah, I mean, trying not to look at your own toes is probably a good thing as much as possible. But, you know, I think that's absolutely reasonable. You know, 6 or 8 weeks ago, we didn't really understand the lack of smell and lack of taste. You know, we do understand that can happen with other viral illnesses as well. I think if you are starting to see some of these other maybe atypical symptoms, but have also had 1 or 2 of these other more typical symptoms, it's certainly reasonable to call up your physician or try and get in touch with your medical team and maybe go get testing. Either acute testing, the PCR testing, or even antibody tests, as we were talking about earlier, if those antibody tests are available, for sure.
We mentioned in that question kids, Dr. Hawkinson. The federal government just launched a new study to get a better understanding of this rare but kind of serious complication where children develop what is known as pediatric multisystem inflammatory syndrome from COVID-19. Talk to us about that, because this started, it feels like forever ago, where we said younger people are not becoming victims of this, and now this is a whole new branch of this. We'll talk about this new wrinkle here.
Yeah, oh, absolutely. You know, we have been thankful that for the most part, children and young people are spared from the complications and the hospitalizations of this disease. But again, this kind of goes back to what we were just talking about. You know, we don't understand the full virology of this infection. Even if it's not the actual virus causing some of the issues or symptoms, like it may be in the lung, because we know it directly affects the lung. We have some weird immune dysregulation that we've learned about. We've also heard about the cytokine storm that happens in our bodies after infection. So this could be just further part of the immune dysregulation that, for some reason, the viral effects on our body cause, and maybe infecting or affecting children in a slightly different way than adults. But it's just one of the more atypical things that we're able to see, hopefully report on, and, you know, as we move forward, be able to either look for it to evaluate and monitor, and then eventually prevent it if we can.
And Doctor, as we move forward with the potential for small social gatherings, 10 people or fewer, and we have kids, I'm just thinking about my toddler. Social distancing is easy for me. It's hard to keep her from hugging her grandparents. And when we're worried about how susceptible they might be to COVID-19, is it okay for your kids to be around a limited number of seemingly healthy people, or do we really need to enforce that social distancing still?
Yeah, that's a very difficult question. You know, we want our grandkids to be able to hug our grandparents and our loved ones and our aunts and uncles. Certainly, just as you said, we know that kids don't physically distance well, and there's roughhousing and hugging and things of that nature, and being close to each other. It's easier for adults to do that. I think it's going to boil down to personal responsibility and risk versus benefit. You know, we want our families to be able to be together and do things together. You know, is hugging okay? I think, you know, you have to take in, well, where have I been? Who else in the household my household been in contact with in other households. You know, if it's really been nobody, then that risk of having an asymptomatic or pre-symptomatic COVID infection is probably very low, and it's probably reasonable to be able to hug grandma and grandpa. You know, every scenario can't be evaluated and determined. It's going to boil down to individual. You know, what is my risk and what is the risk to my loved ones when we do this? Because, you know, we want to get back to family settings and doing things like that.
And people want to be able to do it without being scared of doing it whenever they head out to see family they haven't seen in a long time. As always, Dr. Hawkinson, thank you so much for joining us this morning. Great information you share with us every time we see you. Thank you.